if you're lucky enough that your case of COVID doesn't require hospitalization, treatment could still cost you $1,300 out of pocket if you don't have insurance, $127,000 on average if you need hospitalization and time in the ICU. Peter Lee, president of Covered California, with me now live to talk about how you and your family can avoid that kind of financial stress on top of illness. Good morning to you.
Great to see you. Thanks for having me.
Definitely. $127,000 for a COVID hospitalization and ICU time. This is not the kind of expense that most people can just pull out of pocket. And we're in a sign-up period for Covered California that can really help families avoid that.
Absolutely. So, look, right now is the time to sign up for coverage, but it's also, look, we worry about COVID and we should. But the reason most people go to the hospital isn't COVID. It might be diabetes, it might be cancer, it might be a car accident. The average cost of a hospital stay for Covered California enrolled people is over $40,000. But with insurance, you pay $1,000 or less. And now's the time between now and the end of the month to sign up with bigger subsidies than there have ever been because of the American Rescue Plan that makes healthcare more affordable than it's ever been. We're trying to get the word out, and we really appreciate Fox News is helping get that word out because they can turn to you for where to go.
Definitely can. Now, back in 2013, just over 17% of folks across the state were uninsured. That was before the pandemic. That was down to just 7.7%. Still, even though with that kind of improvement, 1.1 million Californians still uninsured. Why do you think that is? Do they just not believe this program kind of works as well as it does?
Yeah. Well, that 1.1 million uninsured are uninsured and eligible for financial help that for many of them could mean coverage is virtually free. And there's others that are undocumented, aren't eligible right now, but maybe in the next year, given the governor's budget. But the issue is people just think they can't afford it. They think that, oh, I've tried to get insurance before, it's out of reach. And we're trying to make it as easy as possible for people can find out how affordable it is. The other thing is people think it's hard to do. They get confused. And they really need to know that throughout the Sacramento area, there are trained, licensed insurance agents who have one job to help people sign up for coverage, and their services are always free. So we're trying to address those two big barriers, cost and confusion. That is why we think a lot of people aren't signing up right now.
We want to make sure all those hurdles are out of the way. Just to get back to how well this program can work. So you referenced this a little bit. This isn't just for low-income families. The American Rescue Plan, which is the federal response to the pandemic, really helps the middle income who are still struggling with paying for care get covered, right?
That's absolutely right. So look, right now, because of the American Rescue Plan, under the original Affordable Care Act, if you made more than, say, $100,000 for a family of four, no matter how much your health care was, if you don't have employer coverage, you wouldn't be eligible. Now, anyone is eligible, depending on what their income is and how much they spend for health care. So we have middle-income families that were buying their own insurance that are now saving $800 a month, $1,000 a month. Many of them getting the exact same coverage they were paying out of pocket for buying direct from Kaiser or Blue Shield. Every Californian should know if they don't have insurance through their job, now's the time to go to CoveredCA.com, check the private plans they want to pick, get financial help. And we all know because of COVID, mental health issues, staying well matters more than ever. Now's not the time to be uninsured.
And right now, medically, you referenced this as well. Everybody's mind is on Omicron, and we did talk about the high cost of COVID treatment. But being insured and just taking care of yourself, just to emphasize this again, taking care of yourself and your family can help you avoid COVID and may address a lot of the issues that could predispose you to the coronavirus. And there are so many other medical issues that families still need to be paying attention to, like diabetes that you mentioned.
Definitely. I mean, one of the things we've seen is, and you've warned people, it's true, if you end up in the ICU, $127,000 average debt that you'd walk out with. That's like a mortgage. But the people that are ending up in the ICU are very often people that also have diabetes, that have hypertension, heart disease. Getting insurance coverage means you can actually sit down with a primary care doc so you stay well. You don't have other reasons you're at greater risk for the COVID. So getting insurance really is a win-win for staying healthy now and responding to COVID, but actually staying healthy for your family and for yourself over the long term.
Alrighty, Peter Lee with Covered California to give us all the information we need during this enrollment period, which goes until January 31st. And we have linked all the information, including that help that you mentioned, that you can get kind of navigating this system to fox40.com. One place to go look for it, easy to find. Thank you so much for your insight this morning.
Thank you. Be well, be safe.
Definitely. Thank you. You as well.